Good morning. My name is Jamie Peddle. I am joined by my colleagues Sarah Ruth and Andrew Kabchuk. We are parents of autistic children and are members of the Canadian Autism Treatment for Medicare Coalition. We are here today to express our profound disappointment in the National Autism Framework Strategy and the network that the federal government launched on September the 26th, 2024. Approximately 500,000 Canadians live with autism. Although the Canadian government reported in 2019 that the prevalence rate was 1 in 50, the most recent data from the U.S. Center for Disease Control is that autism prevalence rate is now 1 in 36. Autism spectrum disorder is a spectrum with various degrees of severity. At one end of the spectrum are the high-functioning people who are only slightly affected by autism. They can communicate relatively well, take care of themselves, and live independently. Although the American Psychiatric Association classifies autism as a disorder, many high-functioning autistics adhere to the neurodiversity movement paradigm, which does not consider autism to be a disorder, but merely a different way of being. At the end of the spectrum are those who are severely affected by autism. They are low-functioning, often nonverbal, and require constant supervision and assistance. They are not able to live independently. For the parents of children who are diagnosed with severe autism, there are two paramount concerns. The first is getting access to treatment immediately following the diagnosis to help their child develop to their full potential. The second is for their well-being after their parents are no longer able to care for them. There is no cure for autism. However, since the 1980s, studies have repeatedly demonstrated the effectiveness of applied behavior analysis treatment. In 2000, the province of Ontario launched an autism treatment program and assigned it to the Ministry of Social Services, which does not have the resources or expertise to do the job. The same situation exists in most other provinces. Since the Supreme Court of Canada issued its horrible decision in the Otten case in 2004, parents like us have been lobbying governments to deliver autism treatment through the healthcare system with Medicare coverage. In 2007, the Standing Senate Committee on Social Affairs issued a report on the funding for the treatment of autism that recommended the federal government to convene a meeting with the provinces and negotiate a funding formula for the treatment of autism. The government ignored the report. The report's subtitle stated that autism families were in a crisis. At that time, there were a couple of thousand kids on the wait list for treatment in Ontario. Today, there are over 70,000. What was a crisis in 2007 can only be described today as a disaster in the autism community across the country. Children with autism are either not getting the treatment they need or not getting enough to be able to develop to their full potential. In 2016, the Liberal Party of Canada held a national policy convention in Winnipeg at which over 2,200 delegates overwhelmingly voted in favor of a resolution calling for Medicare coverage for autism treatment. Unfortunately, the government ignored the resolution despite Prime Minister Justin Trudeau having said, and I quote him, "How we care for the most vulnerable people in our society is very important," unquote. My 12-year-old son, Jacob, is one of those children severely affected by autism who had to wait an excessive period of time to get treatment from the Ministry of Social Services. He has never received the amount that could have benefited him the most, but only a mere fraction. He needs my help from sunrise to sundown. I love my son, and I do the best I can for him. However, I am a single parent, and as I get older, I increasingly worry about his uncertain future once I'm no longer able to care for him. When Prime Minister Justin Trudeau announced in 2019 that the government would develop and implement a national autism strategy, we were hopeful that access to treatment would improve. It took the government 5 years to develop its framework and strategy. When one reads through the documents, it is clear that the government adopted the neurodiversity's paradigm of the high-functioning crowd while marginalizing and ignoring the plight of those who are severely affected by the disorder. The word treatment does not appear in any of the government's documents. Instead, treatment is subsumed in a lengthy list under the general heading of supports and services, as if treatment were a fungible good that was interchangeable and no different from respite care, service coordination, and parent education. Instead of helping kids get access to the treatment they need, the most the government is willing to do is create new consultation bureaucracies to share information. Not one child on a waiting list for treatment will be taken off the waiting list and get the treatment they need as a result of this autism strategy. Canada is a wealthy, developed, and progressive country that is a member of the G7. Is this the best we can do for those who are among the weakest and most vulnerable citizens of our country? There is only one explanation for this. There is no political will to take care of our kids. If we cannot count on the Minister of Health to champion the cause of enabling children with autism being able to access medically necessary treatment through our public health insurance system, then who can we count on? This National Autism Framework Strategy and Network is a huge disappointment that has let us down. What we need is the same thing we've been saying for years. We need autism treatment delivered through healthcare with public health insurance coverage. We need Medicare for autism now. My colleague Andrew Kabchuk will now speak about the lack of group homes for adults who are severely affected by autism. Andrew?
Thank you, Jamie. Bonjour, je m'appelle Andrew Kavchak. Mon deuxième fils, Steven, a reçu un diagnostic d'autisme en 2003 à l'âge de 2 ans. My younger son, Steven, was diagnosed with autism in 2003 when he was 2 years old. He is severely affected by autism, nonverbal, and requires supervision and assistance 24/7. Steven is now 23, and my family's primary concern for his future is housing and care. Our only option is to have him placed in a group home with appropriately trained staff where he could be safe and lead a life with dignity. When we had Steven's name added to the wait list for a place in a group home, we were told that there is such a shortage of group home places that we will be taking care of our son until we can no longer do so, and that there are parents in their 80s in Eastern Ontario who still care for their disabled children at home. Prime Minister Trudeau's announcement in 2019 that his government would develop and implement a national autism strategy gave us hope that the government would alleviate the group home crisis with the same determination with which it pursued its national child care program. Unfortunately, the words group homes do not appear anywhere in the strategy documents. The only thing the government is willing to do is leverage existing actions in the national housing strategy to address the housing needs of Canadians with complex support needs. Despite having taken 5 years to develop this strategy, it does not say how these needs will be addressed. There are no targets for the creation of more group home places or the reduction of the wait lists. The strategy provides no dollar figure to be spent on group homes or anything else, apart from the $6.5 million to establish a national autism network, which itself will take an unspecified period of time to develop an implementation plan. We've had enough of postponement and procrastination. The framework and strategy are flawed policies, and so were the consultation process and the bill that required the creation of the framework. When the Canadian Academy of Health Sciences consulted with stakeholders for the government, it initially indicated it would focus on 3 principal topics, including evidence-based interventions, and would consider, among other things, how to promote treatment. My colleagues and I made submissions to the CHS in which we stated that the provision of ABA treatment should be considered a distinct priority and offered through the healthcare system with Medicare coverage. We also stated that the wait lists for group homes for the severely affected needed to be shortened. The CHS report subsumed the concept of treatment under the heading of supports and services and obfuscated the matter as though lumping it in a basket with other things that have nothing to do with treatment would make it disappear. The same thing occurred with the topic of group homes, which was barely mentioned. Notwithstanding the CHS's initial claims that all voices and interests heard during the consultation process would be factored into its report, our submissions were ignored. Similarly, Bill S-203 says in its preamble that Parliament recognizes that there is a need for autistic persons to receive treatment and that autistic Canadians would benefit from a federal framework that provides assistance with housing challenges. Yet, the bill's list of measures that are required to be included in the framework doesn't mention accessing treatment or housing. The list of 5 priority areas in the framework and strategy are also flawed, as some areas are clearly secondary to others. At a time when there are tens of thousands of autistic children on waiting lists for potentially life-altering treatment, the government intends to use scarce resources to fund autism acceptance campaigns. Whether we accept our children's disability is irrelevant, as we have to deal with it as a matter of practical necessity every day. We love our children and would do anything to get rid of the autism that has imposed severe limitations on their lives without any positive benefits. The government should spare us this acceptance spin and help our kids instead. Similarly, one of the strategy's priorities consists of developing new tools and resources, which sounds an awful lot like a repeat of the $10 million it allocated in 2019 for the creation of a new autism information website that was itself an extension of a 2006 creation of a dedicated autism information webpage on the Health Canada website. We already have enough government information. What we need now is government action. Instead, we're getting more information sharing and consultations through the National Autism Network, which sounds an awful lot like the Canadian Autism Partnership proposal that the government previously rejected in its first mandate. We thought the proposal was a bureaucratic distraction then and still do today. One of the reasons for the flaws in the government's strategy is that it adopted the neurodiversity paradigm and effectively marginalized the needs of autistics who are severely affected by the disorder. Not one child on a waiting list for treatment or any adult on a waiting list for a group home will get off the list anytime soon as a result of this government strategy. Minister Holland described the government's approach as being incremental and suggested that you never get to the top of the mountain unless you walk the steps. Another way of describing the government's approach is muddling through, in which every time the government feels pressure and heat, it offers a Band-Aid solution. Our kids deserve better. We need group homes now. I'll now pass the microphone over to my colleague Sarah Ruth, who will speak about her family's experience moving from Ontario to New York State for better autism care.
Thank you, Andrew. Good morning, everyone. My name is Sarah Ruth. I'm originally from Niagara Falls, Ontario, but I currently reside in Buffalo, New York. I'm here today with my colleagues, Jamie and Andrew, to discuss an issue that's very near and dear to my family. We moved to the United States in 2010. We were never supposed to stay. The plan was always to return to Canada. My husband was under contract as a U.S. military service member, and we had a family obligation, both of which ended within 3 years of our move. But by that time, our son Zachary was diagnosed with autism, and we knew that we could never come home. In New York State, where we live, if you suspect your child has any delays of any sort, you can self-refer to your county's early intervention program. It is available to children with any sort of physical or cognitive impairment from birth to age 3. Zachary started receiving therapy almost a full year before he was diagnosed with autism. Early intervention services are provided to children in their own home, so not only is the child learning, but the parents are learning right along with them. After his diagnosis, his services and therapies increased from just a few hours a week to 25 hours a week. He receives speech therapy daily, OT and PT, and of course applied behavior analysis 4 hours per day, 5 days per week. We were a house of chaos, and Zach was a child so frustrated he would self-injure, scream, bang his head off the floor, meltdowns that could last for hours. He was a flight risk for elopement and drawn to water, so I couldn't even take him out in public without help. He was such a flight risk that he used to wear a tracking device on his ankle called Project Lifesaver, and he took adaptive swimming lessons for 5 years. I'd like to note that the tracking device and the adaptive swim lessons that were partially grant funded were the only things my family has ever paid out of pocket for in New York State. If you could see Zach now, it would shock you. He is the calmest, most gentle young man. I can't tell you when the last time he had a meltdown was because I honestly don't remember. And even when he has frustrating moments, he no longer self-injures. When Zach was little, I feared for a life of him living in group homes at the mercy of staff who could never love him in the way that his family loves him. I made it my mission to try and help him gain as much independence as I could. His therapists, teachers, and support staff through the years have been incredible and are an invaluable resource to me. I'm thankful to them every single day when I look at Zach and I see how far he's come. His daily living skills are on par with typical kids. He can read, write, and do basic math. He's learning how to cook simple meals, and in his free time, he loves to draw. None of these things would have been possible if it wasn't for the therapy and services he's had access to since he was a toddler. As an adult, Zach will have access to a $50,000 US dollar budget a year to help him hire staff who can assist him with whatever his needs may be: budgeting, grocery shopping, home maintenance, cleaning, whatever it is that he needs. Probably the more shocking part is that he could have access to those budget dollars now, but we don't need them yet, and so I refuse to take them. At this stage, I can say with confidence that Zach will be able to live independently as an adult with just a few supports in place. And the weight off my shoulders knowing that is worth everything. I started coming over here to speak on this in 2019. My friend Andrew has been advocating for his son since 2004 when he was just a little boy. Now he's a grown man who's had to go without his whole life because both federal and provincial governments continue to pass the buck. Countless families have gone without help, so you can imagine my utter disappointment and frankly my disgust when I read through the framework. It took 5 years to come up with this framework, and it's absolutely nothing more than words on paper considering there is no budget to support anything written in it. There are no specifics, no mentions of group homes or other types of supportive housing that will be necessary for the families that you didn't bother to help in the previous decades. My biggest takeaway from the entire document is that it states you plan to do more consultations with stakeholders. Where is the representation for the families like my friends here, who've already been completely failed by the lack of care on the part of the Government of Canada? Were they even consulted in the last 5 years at all? Because reading this document, the answer is you couldn't possibly have spoken to the people actually living in this life, the parents and families of the highest needs autistic population. Furthermore, why are you not consulting with other countries and states that do have a valid and useful autism program? New York State's program is one of the best in the United States, and they are so close to Canada. Why wouldn't you consult with them? How can we call Canada a first world nation and still not have appropriate supports for our most vulnerable in society? How does that actually work? And when is someone, anyone in government, going to stand up for these families? It hasn't happened yet, and it's shameful. I can never come home. Think about that. I, as a once proud Canadian citizen, can never come home because my son would be nothing more than a second-class citizen here. But I'm actually okay with that. I accepted it long ago. My family took a lot longer to come around, but eventually they accepted it too. But what I'm not okay with and what I refuse to accept are all of the families across Canada just like mine who are begging for help and have been for decades in some cases. I feel guilty every time I come and speak on this subject or talk to another family, an autism family in Canada. I've seen the looks on parents' faces when they hear Zach's story and come to understand what is possible, but what no one, not one politician, has stood up to do. Zach's therapies and education as a young child cost upwards of $100,000 US per year. It decreased slowly over time as his needs became less and less. It's a shocking number, I know, but when you consider that proper early intervention ultimately costs the government 2/3 less over the course of that child's lifetime, it makes it a much easier pill to swallow. The child has a chance to live a life with dignity, and the government saves money. It's actually win-win. So why is Canada still in lose-lose mode, and what is it going to take to see some actual change? Until you do for the children of Canada what New York State has done for Zachary, you aren't doing enough. If anyone is patting themselves on the back right now for helping further the autism cause, you should hold off because the work is not done. And with the snail's pace it's taken to date, I don't expect that your praise will come anytime soon. Today, we are calling on the government to stop treating the autistic population like second-class citizens in their own country and give them and their families the care, support, treatment, and dignity they deserve. Not 5 years from now, not 20 years from now. We need Medicare for autism now. Thank you. I'd like to open it up for questions.
Quickly, can I get you to all say your full name and spell them, just so we have them correctly on the record here, for anyone who wants to use this? Yeah.
My name is Sarah Ruth, S-A-R-A-H. Last name is Ruth, R-U-T-H. Thank you.
Yeah, my name is Jamie Peddle, J-A-M-I-E. Last name Peddle, P-E-D-D-L-E.
Andrew Kavchak, which is A-N-D-R-E-W-K-A-V-C-H-A-K.
Great, thank you. You talked a bit about how frustrated you are with this framework that has come out. What would you like to see done here from the federal government?
I started protesting on Parliament Hill in 2004. That same year, the Prime Minister called a meeting with the health ministers of the provinces and negotiated over a period of several days health accords where specific funds were tagged for a number of specific medical services. What we've been asking for is exactly what the Standing Senate Committee on Social Affairs proposed and recommended to the government after it conducted an inquiry and issued a report in 2007 in which it's recommended that the government negotiate a funding formula for autism treatment with the provinces. I mean, clearly what we've got is a lack of resources. And, you know, it's so important for kids that are diagnosed with autism to get that treatment immediately, as soon as possible, because as their brains are growing, the synaptic connections, the neurons and so on, it's possible with intensive behavior intervention therapy to help them develop so that, you know, they don't engage in self-injurious behavior, but learn how to speak, how to communicate, how to behave, and learn themselves, right? So, I mean, what we're asking is, you know, over the past couple of health accords, again, you know, the federal government has been specifically earmarking and tagging funds for specific medical services. But every time we ask, can you do the same thing for autism, we're always told the same thing, oh, it's provincial. Well, if it's provincial, why is the government getting away with like all of these other things and ignoring us? I mean, all we're asking is the same thing that the government's been doing for other things, and including, you know, hundreds of millions of dollars to the provinces for mental health, right? And we don't see why it can't be offered through the Medicare system. One of the problems right now in so many provinces like Ontario and Quebec is that autism treatment is delivered through the social services department. This is a healthcare issue. Why should it be delivered through the same department that delivers welfare? It's got a completely different mandate. It doesn't have the resources. It doesn't have the expertise. And from our perspective, it should be appropriately dealt with by the Ministry of Health. And for our children, access to treatment is their core healthcare need. If we have universal healthcare, why don't we have access to the treatment with OHIP coverage in Ontario or Medicare coverage across the country? You know, in the United States, like in Canada, we have a public health insurance monopoly, right? The government sets the rules. In the States, every single state either has a law or a regulation requiring private health insurance providers to cover autism treatment. So, you know, I mean, so that's what we're asking in terms of treatment. In terms of group homes, well, you know, a couple of years ago, the federal government announced that, you know, there's a lack of housing. So they announced $40 billion for a national housing strategy. Why can't they spend some of the money on the construction of group homes? I mean, there's a real crisis in the lack of group home places. I live in Ottawa, and I've basically been told I'm going to be taking care of my son until I can no longer do so, which means either I get cancer, I get too sick, or I die. You know, it's like, Can we do better than that in a developed country like a G7 wealthy country like Canada? So we're not asking for anything that's from the moon or anything. We're just asking to be treated like Canadians.
In your release here, you say it's hard to conceive of how the minister could let us down more than this with this framework. You said it took 5 years to come about, that there was lots of consultation. How was this framework pitched to you initially, and how does it now look to you?
Well, we've been, it's been 5 years since the Prime Minister announced that his government would develop and implement a national autism strategy. And in that same speech, he said, to help people with autism and their families lead fully developed, lives. And from looking at what's in the framework and the strategy, there's going to be absolutely no change on the ground. So after 5 years, we don't see anything happening. And I gotta say, we've repeated, and we're really disappointed about how the CHS and the consultation process, that Canadian Academy of Health Sciences, and the government has completely bought into this neurodiversity paradigm. I mean, clearly what we need are two different strategies. One for the high-functioning neurodiversity crowd who can live independently, don't need treatment, nobody's forcing it on them, but they dislike the whole concept. And we need another strategy to deal with those at the other end of the spectrum who desperately need treatment. They're severely affected, and so on. And when we look at the framework, for example, and the strategy, in the framework section, there's 5 priorities that are listed. You look at the second priority, dealing with economic inclusion. For the severely affected, the only issue is the housing that comes under that rubric, right? Because the employment is simply not realistic. It's not going to happen. But there's a sentence there, after 5 years of consultation, right, and having a secretariat in the Public Health Agency of Canada that should know better, there's a sentence that says all autistics can contribute economically to society and so on. Well, that's not true. A lot can, many can, but not all. And you can't just generalize like that. I mean, some people at the severe end of the spectrum can't make toast. My son can't. We tried to arrange for him to be able to, engage in volunteer dog walking, but somebody has to accompany him so he won't drop the leash, right? So this reflects sort of a view of autism that's like from Hollywood and the Rain Man movies. It doesn't at all speak to us at the other end of the spectrum. And we've tried our best to speak on behalf of our children because they can't, and the government has consistently ignored us.
I just want to add one thing, if you don't mind. This is what we wanted, and this is what the Liberal Party of Canada voted for. The 2,200 delegates voted for. 2,200, delegates voted for Medicare coverage. This is what we want, and so did the Liberal Party of Canada. But we haven't seen it. That's basically what we want. The thing is, we have a Prime Minister who said all these things, but he never even acted on it. We as Canadians, I'll give you a different. Oh yeah, sorry. We as Canadians, we have a tendency here in Canada to point the finger at the Americans and say how life is far much better here, but what the reality is that if you're autistic, that's clearly not true. See, in the United States of America, they actually have federal laws that protect autistic people in healthcare and education. And even the USA Surgeon General, the chief medical officer of the United States of America, has even stated that autism treatment is medically necessary and that ABA is the golden standard treatment. In all 50 states, autism treatment is covered under their health insurance plan. Board-certified behavior analysis, they're recognized as health practitioners. What we need is the USA Surgeon General in this building, because Canada, we're lacking in helping the most vulnerable people in our society. This is what we want here. right here. Thank you.
I know you need to, can I just get a clarity on that, just quickly? You said the American situation, so what is the situation for Canada then? How, you're saying US has a way that it's treated medically? Are you saying that here in Canada, it's not treated medically?
No, it's not. Actually, when we did our consultation, they promised us and they said that everything that we have to say is going to be put into the report. Now, if you look at the report, it doesn't mention the word of medically necessary treatment. It doesn't mention the word of Medicare. It doesn't mention for the federal minister of health to convene a meeting with the provinces and negotiating a deal for autism treatment. It doesn't mention that stuff. We've seen pharmacare, dental care, long-term home care, child care. Well, what about autism care? Our children need help. You know, I'm not going to be able to be 60, 70, 80 years old taking care of my severely affected child. I'm not going to be able to do that. Where's Canada? It's pretty shameful when you have a country like the United States of America that actually goes on science and they treats the most vulnerable people like first-class citizens. It's pretty shameful, actually.
There's a couple other reporters that are waiting to ask questions too.
Can I also add to this question? I mean, the whole question about, you know, healthcare and Medicare coverage. Like I said, in Ontario, Quebec, and several other provinces, it's not covered by Medicare, right? Now, Medicare system is controlled by the federal Canada Health Act, right? So I've written to the minister. The minister writes back and says, well, this is entirely provincial. I complain about that and say, well, you know, you guys have influence on the healthcare system. And I get a letter back from the Public Health Agency of Canada saying, under the Canada Health Act, only services provided by hospitals and doctors are covered, and anything else is only at the discretion of the provinces. So she said that this treatment is not given by doctors or hospitals. And I asked, please, join me in a car ride for just 10 minutes. Let's go to the Children's Hospital of Eastern Ontario, and you'll see how it's done in a hospital. Because in Ontario, the government gives the program to the Social Services Department, who contracts it out to regional service providers. And the one for Eastern Ontario happens to be the CHIO, the Children's Hospital of Eastern Ontario, except when you apply to them, you don't show the child's health card. Instead, you just get your name on a waiting list, and whenever it comes up under the budget of the Social Services Department. And when my son was diagnosed, there were 1,000 kids on the wait list in the province. Today, it's over 70,000. Clearly, the delivery model through the Social Services Department doesn't work. And there's no reason why autism treatment can't be considered very similar to rehab. The rehabilitation model for people under Medicare offered through the hospitals, or paid for anyways under the healthcare budgets, that could serve as a perfect model for the delivery of autism treatment, because that's exactly the kind of repetitive exercises for, you know, people who, for example, have suffered brain damage and need therapy to you know, take advantage of the plasticity in the brain to get better. And for some reason, in Canada, we ask for it, and we're consistently told no.
If you have a question.
Please use the raise hand function. As usual, one question, one follow-up. Si vous avez une question sur Zoom, s'il vous plaît, utilisez la fonction main levée, comme à l'habitude, une question et une question de suivi.
Can we just talk a bit about your situation in the United States? You talked a bit about your disappointment with seeing these recommendations. And you've spoken about the 6.5 million. Can you just, because you're reading about some of the concerns you have, can you just kind of explain your frustration with these recommendations and the money that is in there and that is not in there?
Well, if you figure my child alone was $100,000 a year, US dollars a year for his therapy. So 6.5 million isn't cutting it. Like that's not treatment for children. That's 6.5 million to talk about more strategies.
That's just for a network.
It's exhausting. It's exhausting. And you know, poor Andrew's been trying to do something with this for 20 years. Jamie and I are a little bit newer to it, but you know, every year we come and do this, Jamie's son gets older and older and still has not had anywhere close to what Zachary has had in New York State. And, just to throw in there, like, the United States has there is national rules, meaning that your health insurance must provide, but New York State goes a step above that. And so my private health insurance was never once accessed for his treatment, ever. It's all paid for by the government in New York State. So they go over and above. So there are states who do better than other states, but any state in the United States right now, unfortunately, is better than what Canada is doing, which is nothing.
Can I add to that? Okay, let's be clear that the only money that's referred to in the strategy is $6.5 million for the creation of a network. And that's to develop an implementation plan for the strategy, which is supposed to be the implementation plan for the framework. Now, we've got enough of this, it take 5 years to figure out that we're going to do something, and what we're going to do is we're going to take another 5 years to figure out what to do about it or whatever. From our perspective, what's missing, of course, first of all, is lack of funds to actually do anything meaningful. What we've got, which is totally unsatisfactory, is the government has picked the lowest hanging fruit possible, the easiest stuff to do. And when you look at for example, the one about surveillance, we're going to do enhanced surveillance. Well, when my son was diagnosed, the prevalence rate was 1 in 150. One person in 150 was being diagnosed with autism. The government did a report in 2019 saying it's 1 in 50, which corresponded with what the Centers for Disease Control in the United States was saying at the time. However, earlier this year, the government said, or the CDC released a report saying that the prevalence rate is now 1 in 36. So over 20 years, it's gone from 1 in 150 to 1 in 36, right? And I'm not an epidemiologist or whatever, but it seems to me pretty alarming. And what the government does is they say, well, we're going to do surveillance. And in the same paragraph, they say that surveillance happens to be the core function of the Public Health Agency of Canada. Well, in other words, the strategy is we're going to do our jobs. We're going to fulfill our mandate. I mean, and throughout this, in every section, every priority list of actions and so on, there's a reference to consultations and increased information sharing, enhanced information sharing. I mean, good grief. The telephone was invented 150 years ago. We've had the internet for over a generation. And in 2024, we have a federal government that says, hey, we're going to share some information. What, we're supposed to be excited about this? I mean, this is unbelievable. I mean, this is the lowest hanging fruit possible. After 5 years, we expected more than this. And in fact, they don't just take the lowest hanging fruit, they take stuff that they already threw in the garbage years ago, because this network seems to be entirely based on the model of this previous autism partnership project proposal thing. The government spent a couple of $1 million in 2015, 2016, having some outside agency consult and make a proposal for a new bureaucracy that would be involved in information sharing and trying to figure out best practices, although they never mentioned checking what's on the other side of the border in New York State. And this National Autism Network seems to be just a revival, like, old wine in a new bottle with a new label. And the ironic thing is, if it's so good now, why did they reject it 8 years ago? The government never actually stated back when remember Jane Philpott? She was the Minister of Health. She got that report. She sat on it, and the autism community were waiting. What are you going to do? What are you going to do? Nothing happened. Nothing happened. And then there was a debate in the House of Commons, and all these Liberal cabinet ministers and MPs got up and talked about how they love autistic people who are so wonderful and how much they do for autism. But no one said a word about why did they reject this partnership proposal. So I don't know why it was not good 8 years ago. Suddenly it's good. I can say, though, this, that we didn't like it. I and many of my other friends didn't like it 8 years ago because to us it was just more postponement, more procrastination. What we needed is action, and instead the government offers us another bureaucracy. Well, back in 2006, I mean, Tony Clement was the health minister, and he assigned the file to the Public Health Agency of Canada. They created a National Autism Secretariat. What do we need another bureaucracy for? And, you know, to tell us that they've done another bureaucracy, they checked the list off of, you know, done that, and what, we're supposed to be excited and happy and vote for this?
You know, the government can spend all the money in the world it wants to, but you know what? It doesn't change what we need as families who have children with autism. The needs don't change. It doesn't change. What we need is Medicare for autism now. We need access to treatment. This is what they do down in the States. They don't fool around with this. This is what the scientific community has proven. Early intervention is the key. That's never going to change. So they can spend all the money. And then also what we need is we need group homes with trained staff. We don't want homes where people are drinking coffee and eating donuts. We want trained staff to deal with our children. So what this government is doing is just, it makes no sense. It's just more delays, making sure that they're acting like, oh yeah, we're going to do something. We're going to say, you guys ain't doing nothing. Because what we need is this here, Mark Holland. This is what we need here. I talked to him about this. And exact words he said to me, Mr. Mark Holland said, well, Jamie says it takes a long time to implement this. I said, are you kidding me? This is 8 years ago, Minister Holland. You're telling me it takes a long time for you guys to implement this policy? This is what he says to me. He says, oh, you guys are going to be happy with it. We're not happy. It's in the report. It doesn't say anything what we're asking for. Nothing. It's shameful on Canada. Very shameful.
Thank you. This concludes the press conference. Merci.
Merci.
Merci.